Here are the normal ranges and prices for the 8 blood tests that are necessary to check you for diabetes. Out of this, the first and most important is the fasting sugar test. In this test, you will not have to have anything to eat for at least 8 to 12 hours, and after that your blood sample will be drawn. A normal range is less than 100, and anything more than 126 is already a sign of early diabetes. The second test is the post-meal test. Now this is done 2 hours after you have a meal, for example breakfast or lunch. 2 hours after that, your blood sample will be drawn and it is tested in the lab. For the post-meal test, a value should be less than 140. The third is the random sugar test. In this test, we can take a blood sample at any time of the day. It doesn't matter what you ate, when you ate. It's called the random sugar test because it is done at random. And just because of that, the normal range is also very wide. It goes all the way from 70 all the way up to 199 or 200. After this, we have the HbA1c, which is considered to be the most important test for diabetes diagnosis. It gives us the value of your sugar over the last 3 months. The normal range for the HbA1c goes from about 4 to 5.6%. Anything more than 6.4 is considered to be diabetic. Other than this, we have 2 to 3 other tests. One is the fasting insulin test, which is a very good test to check for insulin resistance, which is the early stage of diabetes. As well as we also have the C-peptide test, which can be of use in people who are already on insulin to check how much their body is actually making the insulin. And the last is called the glucose challenge test, which is a standardized way to check for how well your body is handling glucose. It involves first giving a sample after fasting for 8 to 12 hours and then drinking a solution of 75 grams of sugar. After 2 hours, another blood sample is taken and then we check the difference between the two values.